tooth cavity doesn't hurt, and waiting for your tooth to start hurting is a big mistake. Welcome back to my channel. I am Dr. Salman Khan. I am a dental specialist orthodontist. Here, this channel, my purpose is to give you advice which is not sponsored, not influenced, and in any way not biased. This is exactly the advice that I give to my patients in my own clinic and my family members, friends, and well-wishers. So without further ado, let's get down right into today's topic. So if a cavity doesn't hurt, does it mean that it's not serious? That's what most of my patients tell me. Yeah, see, look, I have this food that was getting stuck in my tooth for a long time, doctor, but there was no pain, or I can see there is a big hole and that area is darkened, but because there is no pain, I was like, okay, it's not a problem, let it be, until later when they leave it for too long. After a few months or years, suddenly the pain erupts like a volcano, and then you are in our office and it's an emergency appointment. So here, as a dentist, I am here to tell you that pain is often the last sign of advanced dental disease and not the first sign. So in this video, we are going to talk about why the pain doesn't come right in the beginning, why many cavities don't hurt, when pain actually starts, why pain is risky, and how we can catch these problems early. So let's understand this simply. A cavity doesn't appear overnight. First, it's small. It starts like a small plaque buildup, then tartar accumulation, and then acid attack, enamel demineralization, enamel loss. A small portion of enamel gets eroded in the beginning, it gets decayed, and then the incipient caries, the beginning of the caries of the disease starts, where it slowly starts eating away enamel. Slowly the enamel is getting lost due to repeated acid attacks. In the early stages, the cavities are very small, absolutely no pain, and absolutely no other issues. You could just slightly feel it, possibly with a toothpick or when you run your tongue around it, but sometimes most of the patients tell, I didn't even know that I have a cavity. So in your tooth, there are multiple layers, the topmost layer being enamel, and then comes dentine, and then comes the pulp, which is the heart and where the nerve endings of the tooth reside. So as you can see, when the decay starts in the enamel, there is absolutely no nerve endings or nerve receptors. So even if until this entire layer gets decayed and eaten away for months and sometimes even years together, there is no pain. And patients can actually visualize it. When they see in their mouth, they can see that there is a hole, there is a cavity, it's blackened or it's brown, it's darkened, and food is getting stuck, but because I have no pain, let me just sleep on it. So that's exactly what's happening, is only the enamel layer is getting depleted. But enamel layer takes a long time to get depleted, maybe 3 months, 6 months, 1 year. But as soon as the enamel layer completely gets depleted and you hit the next layer, dentine, it is soft. Within a month, the dentine gets depleted and immediately touches the pulp. So the patient's generally complaint is that, doctor, for years together I was eating, normally I had a cavity but there was no pain, but all of a sudden yesterday I ate bread and then it suddenly started hurting. So please don't hold the bread as culprit. Hold that years of negligence that we have done, not gotten a checkup, not proactively fixed that cavity, that has led to this situation. So on the surface, you're going about your daily life normally, you're eating everything normally, you're eating hot, cold, you're having ice cream, you're drinking hot coffee, you're drinking cold beverages with ice, and still you feel no pain and sensitivity. That's because all of this is still restricted to enamel and then to dentine. The moment the dentine layer gets eroded, that's when suddenly a sharp pain arises, and then you tell that, I need to see a doctor and this is no longer bearable. So what I want you to understand is, if you were to get a regular checkup done, and when the cavity is still in the enamel stage, we could do a simple restoration of filling without even the need of anesthesia, without doing any complex procedure, and without it costing you anything heavy on your pocket. This tooth can be restored for function and it can serve you for a long time. But having let it grow deeper and deeper, once it's in the enamel layer gone completely, and then it erodes the dentine layer and then finally comes to pulp, and you come in pain, now a small simple filling is no longer possible. We will need to do a root canal, and sometimes If the decay is severe, you may even lose the tooth. We may have to tell that root canal is not possible if the infection is severe, and it will go for extraction. So you may tell that, I have a brother or sister or someone in the family, I can see their teeth are really decayed but they don't feel pain. That is because not everyone feels pain the same way. Their enamel layer progression may be slow, they may have a wider cavity or a thinner cavity, or their nerve must have already been compromised, because of which they no longer feel pain. Please remember that just because you don't have pain, that doesn't mean that there is an active infection absent in the mouth. A long list of patients I could recall where there is absolutely no pain, but when we take an X-ray and see there is a huge infection that is sitting at the bottom of the teeth waiting to explode. And sometimes without even pain, they just come with a big swelling, and that's when we realize, okay, this is a long standing problem. And the patient comes and tells, but you know what, doc, I've never had pain in my life. And that's when we diagnose such silent cavities, silent decay, and then we have to do extensive treatment. So I think here it's clear that waiting for your pain to come is an extremely bad strategy. It almost always leads to more aggressive treatment, larger treatment, more number of sittings. It cannot be limited to a simple restoration. It may require a root canal, it may require a crown, or it may require an implantation and an artificial tooth. And the sooner you get this fixed, the sooner you get this checked, it will be a more simpler and cost-effective treatment for you. So remember this, no pain does not equal to no cavity, and no pain does not mean that your teeth are healthy. What it means is you're not getting a proactive checkup done. Think of it like you've purchased a car or a two-wheeler, and every 6 months you are recommended by the manufacturer to get it serviced, but you're not going and taking your car, you're just riding it. Even though you hear a little bit of squeaking here and there or some problem here and there, you ignore it. It's like, my vehicle is running fine, let's see, when it breaks down I'll take care of it. By then it's always, almost all the cases, very late. Now here's the good news, not all cavities are complicated, not all treatments are extensive, and most of them are always preventable. So in my next video, I'm going to talk about the most essential but minimal oral routine care that you need for this year 2026. That's all you need to make sure you have perfect oral health. So stay tuned until my next video. Please share this video if you found it useful with your loved ones. Your sharing, liking and subscribing to my channel keeps me motivated to bringing you more such videos week on week. Until then, see you. Bye bye.